If you're in the UK, you've probably felt it. There's this growing sense that the systems we all rely on, healthcare, infrastructure, you name it, are at a breaking point. The cracks are becoming impossible to ignore. So in this explainer, we're going to dig into the hidden reason why this is all happening. And believe me, it's a problem that's been quietly getting worse for years.
I mean, the signs are everywhere, right? We see crumbling hospitals, overcrowded schools, and infrastructure that just can't handle the pressure anymore. It all boils down to one huge question. Why? Why is this happening now? And here's the thing. The answer isn't some super complex, locked-away secret. It's actually a colossal problem that's been hiding in plain sight for more than a decade. So let's pull back the curtain and find out exactly what's been going on.
Okay, so first up, let's just look at the evidence. The cracks in the system aren't just showing anymore. They're becoming gaping holes across pretty much every public service we depend on.
Let's kick things off with a number that's, well, it's just staggering. 7.39 million. That's the number of cases on the NHS waiting list. To give you some context, the standard 18-week wait time for treatment hasn't been met since 2016. Think about that. That's almost a full decade of just falling further and further behind.
And if you think that's bad, when you look at emergency care, it gets even worse. The number of patients waiting over 12 hours for an emergency admission is a jaw-dropping 97 times higher than it was right before the pandemic. This isn't just a backlog, you guys. This is a system that is literally at its breaking point.
And it's not just healthcare. Our whole national infrastructure is taking a serious beating. £2.4 billion. That's the annual cost of the immediate physical damage from flooding alone. And with climate change making these events more common, that number, it's only going up, putting relentless pressure on systems that are already on their knees.
And this is so important to get. These are not separate, isolated problems. When hospital bed occupancy is consistently over 90%, you get gridlock. When the education gap is the widest it's been in a decade, that damages an entire generation. When critical facilities are literally being shut down because they're decaying, well, you see the pattern. It's all one giant, interconnected, systemic failure.
Okay, so we've seen all the symptoms, the cracks in the walls, right? But what's actually causing the rot underneath? Well, the answer lies in one single, frankly shocking number that reveals a massive debt of neglect.
You see, all those things, the operational failures, the long waits, the crumbling buildings, they're just the symptoms of a much, much deeper financial problem. It's like this hidden national debt that you won't see on any of the official balance sheets.
And here's the number, a massive £49 billion, at least. This is the estimated price tag for the deferred maintenance backlog across all government properties. We're talking hospitals, schools, courts, the whole shebang. And the crazy part is, the source material suggests that's probably a lowball estimate.
So what is this deferred maintenance backlog anyway? Well, to put it simply, it's a debt of neglect. It's the grand total for all the essential repairs, all the upkeep that just had to be done that's been kicked down the road year after year just to save a bit of cash in the short term.
Now, £49 billion is one of those numbers that's so big it's kind of hard to wrap your head around, right? So let's break it down. It works out to about £710 for every single person in the UK. This isn't just some abstract government figure. This is a very real debt hanging over every single one of us.
But what's really wild is just how financially bonkers this whole strategy is. I mean, look at this. Planned preventative maintenance has a certain cost, but waiting until something breaks and then rushing in with a reactive Band-Aid fix, that can multiply the cost by up to 3 times. So yeah, kicking the can down the road isn't saving money. It is actively, massively wasting it.
And here's where the rubber really meets the road. You can draw a straight line from this policy of inaction, of just putting off repairs, to the incredibly dangerous consequences we're seeing. This isn't just a theory. In the NHS alone, failures in the buildings, in the infrastructure, cause over 5,000 clinical incidents every single year. Just think about that. Over 5,000 times a year, someone's health is put at risk because a building or a piece of equipment failed.
So you can see, this isn't just a story about budgets and leaky roofs. The consequences of this systemic neglect, they ripple out and touch everything. Our health, our economy, and maybe even the trust we have in society itself. And this next number, well, it's a really tough one to swallow. The source material we're looking at cites research linking post-2010 austerity measures and public spending cuts to an estimated 190,000 excess deaths between 2010 and 2019. It's just a devastating reminder that when public services are starved of funds, there are real human costs.
You know, when services just consistently fail to do their basic job, it's more than just an inconvenience. As this quote puts it, it can lead to a crisis of the whole system. People start to lose faith. They start to wonder if the very institutions that are supposed to be there for them can even do their jobs anymore. This debt of neglect, it's like a sickness that spreads. It doesn't just cause buildings to fail, it creates this whole cascade of other problems. The human toll is enormous, with poor mental health costing the economy over £100 billion a year. It's an economic drag as big companies start to pause investment, and all of this just fuels that dangerous erosion of public trust.
And let's be clear, this crisis didn't just pop up overnight. It's the end result of choices that were made over the last decade and a half. You can literally trace a line from the austerity policies back in 2010 to the NHS missing its targets by 2016 to that maintenance backlog just growing and growing, landing us right where we are today, with record-breaking waiting lists.
Okay, so that's the diagnosis, and it's pretty grim. But is there a way out? The good news is, the analysis doesn't just point out the problem, it also lays out a clear path forward. It's all about a big shift in thinking, from just trying to manage the decline to actually building real, lasting resilience.
The analysis lays out a four-step plan, basically. First, you got to tackle that £49 billion backlog head-on with dedicated, long-term funding. Second, you have to strategically plan for the workforce we'll need, like the nearly 500,000 new social care jobs required by 2035. Third, we need new, more stable ways to fund big projects. And finally, and this might be the most important, you have to restore trust through openness and transparency.
And really, this is the main takeaway from all of this. This cycle of crisis after crisis can only be broken if we completely change our mindset. We have to stop slapping on these short-term, reactive band-aids and finally commit to strategic, protected, long-term investment in the things that hold our society together.
And that really leaves us with one last big question to think about. We tend to take for granted that we'll have working roads and safe hospitals and good schools. We see it as an inevitable part of living in a modern country. But what all this evidence suggests is that it's not inevitable at all. A functioning society, well, it's not a guarantee, it's a choice. And it's a choice we have to keep making consciously and consistently through the policies we support and the priorities we set.